guys, it's very nice to meet you. So, for all our viewers who are watching, I just want to introduce our amazing speakers. So, first up, we have Maya Murali. He's a dual specialty in anesthesia and intensive care. He has exciting experience in doing a fellowship outside the UK and is now pursuing research alongside his medical training, his very busy schedule. And we also have Luke Tester, who is an A&E fellow and dedicates his time outside his very busy schedule to volunteer for the community and has won several awards for his commitments. So thank you very much, guys, for joining us today. So the first thing I'd like to ask you is, how would you describe your job in 3 words?
Who would you like to go first? Shall I go first?
Yeah.
After
So
you.
for all
Yeah.
the questions, could we have you, Maya, first, and then
Oh,
Luke? Is that okay?
perfect. Yeah, no problem. So, as you mentioned, I'm an anesthesia and intensive care doctor and also a budding clinical academic. And if I could describe my job in 3 words, it's humbling, variety, and high stakes, which is a bit of a cheat because it's 2 words, but it's hyphenated.
Brilliant. Luke?
So you've stolen some good words there, Maya. I would agree. I would say that emergency medicine is varied, it's challenging, but exciting.
That's great. I think those are definitely some words people would think of when they think of A&E medicine, being in the emergency department. So what does a day at your current job look like?
So I'm still rotating through training at the moment. So my current job is doing pediatric anesthetics, which is, as you might sort of guess, is quite varied. So it starts off with waking up at sort of 5:30 in the morning to get to work for 7:30 because we see our patients at 7:30. We do a kind of a pre-assessment, building some rapport with both the kids and the parents. And that involves kind of doing a full clinical examination, taking a full clinical history, and working out what your anesthetic plan is going to be for delivering the anesthesia for those children. And it's often about allaying fears at that stage because you can imagine that parents and the kids are all terrified when they come in. So it's trying to be as light and breezy as possible, despite the fact that you're probably not fully awake. We then do 2 to 3 cases in the morning and 2 to 3 cases in the afternoon. Varies depending on what type of list it is. So we do all variety of lists, things like pediatric dental, pediatric urology, general surgery, etc. And the cases themselves consist of a mix of practical skills, clinical assessment, and also sort of documentation and ensuring that everything we do is documented to a high standard. So practical skills, things like managing airways, putting in IV lines, performing nerve blocks, local anesthetic injections. So real variety, really interesting. And then at the end of the day is basically going around and seeing that all your patients are okay, and then looking up the patients for the next day to try and work out what you're going to do.
Luke?
So I get a positive line compared to Maya. I get up at 6 to start for 7:45. And I'm an emergency medicine trainee. Now, in the first few years of being a trainee, you rotate around different specialties. So you'll do emergency medicine, acute medicine, which is the first stage of being an inpatient in hospital, anesthesia, intensive care, and pediatrics. So my current job is a year in anesthetics and intensive care. So I'm not going to rehash what Mayor's doing. He's clearly on the pediatric specialty year, which I focus more on the basics and the adults at the moment. So I guess there are 2 things I can talk about. One is what I'm currently doing, and one is emergency medicine as a general specialty. So currently in anaesthetics, like Mayor, I'll go to see the patients in the morning and work out what type of anaesthetic they need for their operation. It could be any operation that they're having, really, that our centre offers. So it could be broken bones, it could be abdominal, it could be gynecological, urological. There's a whole range of things. But with each of those and with different comorbidities comes the need for a different anaesthetic. So some people will have a general anaesthetic, some people will do under local anaesthetic, and some people are sort of in the middle where we'll do what we call a regional anaesthetic. So we will switch off part of their body using an injection either around the nerves or into their spine. So we'll anaesthetize them, look after them for the case, and then move on to the next case and look after several cases a day normally. When I'm on call, so in the evenings, at night, or weekends, myself and my team will look after the intensive care units, the high dependency units, the operating theatres, and the any emergency calls between the three of us. But when I'm working in emergency medicine, it's a little less planned, shall we say, because you just never know what's going to come through that door. We have 3 different areas in the emergency department. So we've got our minors, our majors, and our resus. Our resus is for the sickest patients. It's for those who will die without intervention, essentially. As they come in, normally by ambulance, will be met by possibly a team of doctors, a team of nurses, and other healthcare professionals as well. We'll take a history, we'll do an examination, and we will investigate to work out what's going on. And that could include ECGs, observations, blood tests, imaging like CT scans, and to work out how we can stabilize them. So resus is the sickest patients. That's always an interesting, varied, but challenging shift. Then we've got majors. That's the next level of patients. So these are people that are unwell, but don't need resus level care. That could be because they're having a stroke, having a heart attack, they've got injuries, they're septic, they've got a pneumonia, whatever it might be. We'll look after them in majors, and then minors is really everything else. It's a bit of a misnomer because it's not necessarily minor to that patient at all. It could be very significant to them. Piano player that's broken their hand, or a model that's got a facial injury, could be hugely significant to them in their life, but it doesn't need a bed in a major setting with all the monitoring and more intensive support that's provided there. So my job as a doctor there is to often look after multiple patients at once, to work out who's the sickest, how we can support them, and it's all about being a detective. So in emergency medicine, we really are diagnosticians. We are presented with a blank slate, and we need to be aware of things like our biases. We've just seen 3 chest pains that were nothing. And so, they weren't cardiac, they weren't thoracic, there wasn't anything significant. And so that patient was reassured and discharged. But maybe the next one is a heart attack or is an aortic dissection. And so we're competing with the environment, with the pressures, with the number of people, with our own biases, with the pressure from specialties and from patients waiting to give the best service we possibly can. And sometimes you get to do some really interesting medicine. As I say, anything can walk through the door. So it's a mixture of working up what's going on, medical skills, using lots of your medical knowledge, and also some surgical interventions as well.
Brilliant. So that sounds really interesting. I'm a medical applicant myself, so hearing about your lives and what you do on the daily just gets me really excited. So what's your favorite thing about your job?
So my job is fantastic, and I've spoken to you about this before, actually, that I know there's a lot of I guess social media induced apathy about medicine, but medicine is probably the most fantastic job in the world, I think. And there are lots of things I love about it. So for my own personality, it's very task orientated, which means that when I go in for a daily job, whether it's on anesthetics or on the intensive care unit, there's always a list of things to do. And I love getting to the end of the day and saying, I've provided this number of anesthetics, I've done this number of procedures, I've seen this number of patients, I've diagnosed this number of conditions. It's a really nice sort of tick list, which feeds into my personality. I think responsibility is a big thing. So Luke touched on quite a few things there, the sort of variety that you get walking through the door, but also the role that we have not only as managing patients, but also in all aspects of the patient pathways. So we advocate for patients. We have a duty of confidentiality towards patients. We have a duty of sort of behavior. So we have behavior standards that we're supposed to uphold. And all of those things make sure that you are acting to a high standard at all times. And you take people's lives literally in your hands. So when I'm doing anesthetics and intensive care, when I say it's high stakes, I mean that literally when I do things, people could die if we don't, support them appropriately. So that responsibility is a big thing, but I absolutely love it. one of the other things is variety and opportunity through the career pathway. And I'll talk a little bit later about some of the things I've done through my career. But medicine is a real avenue into lots of different things. And you don't just have to be a clinical doctor, although being a clinical doctor is fantastic and, you know, one of the best jobs in the world. But if there are other things that interest you, you can do so many things with a medical degree. Just from a purely kind of selfish point of view, there's always an opportunity to earn extra money. So speaking as someone who has several relatives in the financial sector, and for them, for example, they can't do a locum shift or a private shift and pick up extra cash on a month-to-month basis, whereas I can with my job, which is great. I also think being part of a community of intelligent, articulate, and emotionally intelligent people as well is a really fantastic thing. So I'm not just talking about being in a community of doctors, but also a community of nurses, community of all healthcare professionals. It's a wonderful place to work, and you really feel valued and part of that team. And the final thing for me is research. So I've obviously got a research interest, and that's something that's developed over time. It's not something that I particularly wanted to do right from the beginning, but the opportunity to be able to do that is wonderful. And I feel really sort of thankful that my job allows me to do that and hopefully produce some breakthroughs for patients in the future.
Great, thank you, Maya. And Luke, what's the favorite thing about your job?
I really like the variety that emergency medicine provides, with both the patients that you are looking after, their presentations, but also some of the added things you can do. So as Maya said, medicine can open doors into lots of different avenues, both medical with things like you're choosing your specialty and your subspecialty if you'd like to, but also outside of that. So I've got interest in teaching, I've got interest in pre-hospital care, and also in some of the how we can improve services, how we can make the whole system better for our patients as they travel through that journey. And there are opportunities to expand and develop in those. Clinically, I really like that we, in emergency medicine, very much work in a team. And I am fortunate to have the opportunity to lead teams with very sick patients at times. And that might be a resuscitation, that might be, gosh, it could be anything really. But we really get challenged and we'll challenge each other. And that is stimulating. You've got to have a good foundation in your medical basic sciences. So that's your anatomy, your pharmacology, your physiology, your pathology, your microbiology, all of those things, which is why you've got to do exams throughout. But when you get to use that, when you get to apply all the knowledge that you've been building up over the last 10 years, I find that really satisfying.
Yeah, that's brilliant. And you guys are both really specialized and you seem to really be enjoying your specialties. I'm sure you've had to make lots of decisions along the way to get to where you are now. So can you guys walk me through your career path since you left Challengers?
So yeah, so we had a quick chat before about when we graduated from Challengers. So I'm a bit older than Luke, and still unfortunately in training. So it is a long pathway, but I took a bit of a roundabout route to get there. So once I finished my A levels, unfortunately I didn't get the grades for medicine actually at A level. I got a B in chemistry when I needed an A, and so I went and did a biology degree up at Warwick for 3 years, and then after that I was thinking about medicine, but I wanted to do the 4-year course. I didn't want to do the 5-year course. So the 4-year course is basically a graduate entry course where they amalgamate the first 2 years into one. And you can do that if you've done an undergraduate degree before. So I took a year out and I actually worked in business for a year. I won a competition called the Graduate Apprentice, which was loosely based on The Apprentice. And so I worked for Deloitte, I worked for a property management firm, and I also worked for a management consultancy, which was a fantastic year. I got a couple of job offers at the end of that, but it was always my intention to apply for the 4-year medicine course, as I mentioned. And fortunately, at the end of that year, I got an offer from Barts in the London Medical School. So I went there, did the 4 years there, had a great time. Barts is, I'm sure they won't mind me saying this, is not the most academic medical school in comparison to some of the others. So I had a fantastic time there socially. And I would always encourage people to go to medical school to basically enjoy it as much as they can. The career stuff will come later. I did my foundation training in East London, and then I took what's called an F3 year, which is basically when you take a year out of training, and use that to build my CV. So I did a diploma in tropical medicine and hygiene. I did a trust grade, what's called a trust grade or a non-training job in intensive care. And after that, I applied for anaesthetics training and fortunately got a training number. So then I did 2 years of anaesthetics training, and then there's another break where you have to apply for registrar training. And I decided to take more time out. So I did a leadership fellowship at NHS England, which was one of the best things I've ever done. Really enjoyed it, learned some of the competing interests within healthcare at a kind of national level, and worked on some really interesting projects. And then just pre-COVID, I managed to do an anaesthetics fellowship in Zambia, which was also an amazing thing to do. I absolutely loved it. Made some real friends for life. My wife fortunately gave me permission to go away to do that. And it was just pre-COVID, actually. So we were very lucky because the people who were doing the fellowship after us, actually everything got cancelled, and all the fellowships after us got cancelled for 3 years. So I feel very lucky to have been able to do that. And that was a mix of things. So doing some developing world anesthesia, doing some intensive care there, also doing some education, but also lots of travel and just enjoying life. And then after that, came back. Obviously, things have been difficult during COVID, particularly in emergency medicine, in anaesthetics and intensive care. We were all really, really hit by the pandemic. But I've continued with my training. I'm now a dual trainee in anaesthetics and intensive care medicine. And I also got an academic training number, which basically meant I've had 9 months of protected research time during my registrar training to do research. Where I am at the moment, I'm applying for PhD funding to take more time out of my training pathway. I've got 2 years of clinical training left. And hope to be a clinical academic and dual consultant in anaesthetics and intensive care medicine at some point in the future, probably when I'm about 40, which probably feels a long way away to you, Tarana, but it's not that far away for me.
Right, brilliant. And Luke, can you walk us through your career path?
Sure. So I left Chandler's in 2012. I had a year out where I went travelling for a bit and worked in Harefield Hospital, which is a cardiothoracic surgical hospital, as a healthcare assistant. And I loved that. I found that really beneficial, actually. Then applied for medical school and went to University of Exeter in 2013. Spent 5 years there, graduated in 2018, and moved down to Sussex on the sunny south coast. So I spent my foundation years in Worthing, which was a really lovely hospital. I had a great time there. And in your foundation years, you rotate around different specialties. You change every 4 months. So I went through acute medicine, gastroenterology, care of the elderly, general practice, cardiology, and then COVID hit. And that meant that the rotation stopped. And we all went onto a COVID emergency rota for the last 8 months, really, of that year. And the medical year runs August to August, similar to the school year, because that's when everyone starts there and rotates on their training jobs. After I left Worthing, I moved over to Brighton in the sunny south coast again, just down the way. And Brighton's a fantastic place to work. It's the major trauma centre for the southeast coast. It's quite a busy hospital. It's a very busy hospital, which was quite challenged with some of the infrastructure and the buildings that had there. The oldest building there was nearly 200 years old and predated Florence Nightingale. So it's only just been replaced a bit earlier this year. But it was really busy, and with it being a major trauma centre and working in A&E full time, you get lots of very interesting emergency cases being flown in or brought in. And it's the most fantastic team I've ever worked with. It was absolutely brilliant. And I learned a lot about emergency medicine there. But whilst working there, I had what was called an educational fellow job. So I worked 48 hours a week. 75% of that was on the shop floor. So whatever that is, 37-ish hours a week in A&E working clinically. The rest of my time, I was teaching at the medical school. And I spent the first year teaching all 5 years of a medical school and some physician associates, and also completed my postgraduate certificate in medical education. And then the next year, I loved it so much, I did it again, and I took on the lead role. So I led a team of 30 fellows to do the same thing, whilst also teaching and completed my postgraduate diploma in clinical education. So it opened up avenues for me, both to develop myself, my leadership, but also to get some qualifications and support the wider scope of the future of medicine too, which was great. having done my 2 years there, I knew that I wanted to work in emergency medicine as my career. So I applied for specialty training and was lucky to get a national training number, which is something that you need to have to go into your training. And I wanted to stay down in the southeast where I'm living. So lucky to get a job down here. I work in Tunbridge Wells, just across the Surrey-Kent border, and I'm in my second year there. So I mentioned earlier, you do your rotations in your first few years, emergency medicine, acute medicine, intensive care, anaesthetics, paediatrics, etc. So spent a year and a half or so in Tunbridge Wells. And next year I'm off to a hospital in Surrey to carry on, and that's where I'll start paediatrics.
Oh, that's great. So two very different stories, I think. One's quite one's quite traditional, one's not so traditional. So if we go back to where both of you started, med school, what advice would you give to someone who's applying to med school?
So the biggest thing for me, obviously, given my slightly non-traditional pathway to get there, although, I suppose it's becoming more common that people will end up doing a degree first, but before they do their undergraduate medical degree. But the thing I would say is there is no single way to enter a medical career. So if you are set on doing medicine and you really want to do it, there is nothing that should get in the way. And ultimately, you're going to have a 50-year career. So even if it does take you a little bit longer to get there, I think it's definitely worthwhile. And as I say, I've never regretted not taking up that job at Deloitte and instead doing medicine. So I think it's been wonderful for me. I think the other thing is, if you do want to do it, you should think about it early and get some work experience. And the reason I say that is because lots of people come into medicine, they do the preclinical years, and then they get on the wards in their third year and they're suddenly like, actually, I don't like this. I hate being in hospital. I don't like patient contact. I'm not sure it's for me. And so I think really the only way you can truly know is if you're actually doing work experience where you go and meet patients. It doesn't have to be in a hospital. It could even be in a care home. It could be in a GP practice. But really important to see whether it really is for you. And I think that's really key. And it comes across in your interview really, really prominently if you've done that work experience and you have kind of a mature outlook on what the career actually entails. The next thing is not all about the consultant job. So although that is important, actually it's about the journey to get there. And hearing about Luke's journey as well and some of the things he's done in Brighton, that sounds super interesting. And I totally agree that I think medicine gives you that opportunity to basically experience lots of different things. So that would be another piece of advice that I give someone leaving school now. Don't think that, I want to be a consultant by the time I'm 30. Actually, there's lots of things that you can do in the interim. Although if you do want to be a consultant when you're 30, that's also fine. The other two things, make the most of your opportunities and have a growth mindset. I think anybody who wants to do medicine needs to have a growth mindset. And by that, I mean wanting to try and learn new things. And that is prominent throughout your training pathway, but also as a consultant, the learning never stops. And you need to make sure that you have that mindset in order to succeed.
Right, that's amazing. And Luke, what advice would you have for someone applying to medicine?
Yeah, I completely agree. I think going in with your eyes wide open is important. Know what you are putting yourself into, because you've committed yourself to 5 years of medical school, and then you've committed yourself to a career. So when you're applying, you're not just applying for medical school, you are applying to become a doctor. You're applying for that career. And it's not like other degrees where you can study economics and then you've got, you could go anywhere. Well, in some ways with that, medicine sets you up to work in medicine. And yes, it opens up doors elsewhere, but that's the primary outcome. So make sure that you know what you're letting yourself in for. And that involves getting that work experience that Maya's talked about. It involves talking to doctors, finding out what they like and perhaps what they don't like about their job as well. Make sure that you are aware of the realities, aware of the facts. And get, if you can, some experience of working clinically yourself. So volunteering work, I think, is really, really valuable. I volunteered with St John Ambulance and I continue to do so, both providing clinical experience whilst I was at school. I was 16 when I started, and you can't really get clinical experience at 16 in many other places. But if you start to treat patients and you work out that actually you love this, that can really help you, and it'll help in your application as well. I think should have a variety of experiences and interests. We don't want doctors to all look the same. It's not about all going to one school, coming from one background with one set of A levels and one set of interests. We need our doctors to represent the communities we serve. And having variety in who you are, you don't need to be extroverted. We need introverted doctors. We need the whole spectrum. That's really valuable. So don't be put off because you don't look like the doctors you've met, but do ask them about the job. Find out about the job. Go in with your eyes open.
Yeah, that's great. I think unis are definitely pushing to have medical applicants with work experience, and you're absolutely right that we need doctors who represent us and make us feel comfortable. So moving on from the sort of medical aspect, we know that next year is the 400th year that Challengers is actually in existence, and that's great. So I'd like you guys to think back to your time at Challengers. What is your best memory of your time at Challengers?
There are so many of these. I was actually struggling to think about this. I had such a wonderful time at Challengers, but the kind of the three major things that I remember. So we had a Gondar exchange scheme back when I was there, which was basically where we used to go out to Gondar and do a trip there for 2 weeks. Supposedly teaching English and kind of helping build things, but actually it was just a lot of fun. It was a 2 week trip with a bunch of guys, who I'd been friends with for a long time. And it really opened my eyes to kind of, I guess, a different part of the world, and really sparked an interest in traveling and doing some developing world stuff, even as a doctor. The other things, sports and music at school. So I did a lot of musicals, plays. I was in the choir. And I played cricket as well, and all of those things. I've got such happy memories from so many of those. So, yeah, too many to mention, but basically, it was a wonderful time.
It's great. And Luke?
I had loads of great memories and Challengers. I think some of the opportunities that Challengers provided were fantastic. So, both academically, it set me up for the future, but also developing some of the other skills. So, sports, music, all of those things, absolutely. I was fortunate to lead the sailing society, the sailing club, the medic society, the Christian Union, to become a prefect and have the responsibilities that involved. I really enjoyed some of the trips. Berlin was particularly memorable. I was really looking forward to going to Iceland one year with the geography department, but then got glandular fever like 2 days before and couldn't go. That's gutting. Still want to go, still haven't been. But I think probably the thing that stuck with me are the framework that it provided me with to build who I am, but also some of the people. The people there, the teachers I'm still in touch with some of them, but just fantastic. But the friends I made there as well, I still very much see my friends from Challengers regularly. A few of us have got married, having children, and we're still a close network. And that carries forward with you. The people you met at Challengers, and the Challengers Connected portal is really nice as a way of staying in touch with those that you may not see as regularly. Had a great time there.
That's great. I was expecting more cheeky stuff because I know the boys at our school get up to lots of mischief around, but I'm glad you guys had a good time with all of the co-curriculars and extracurriculars at the school.
Yeah, this is recorded, so we've got to limit what we say.
Oh,
Yeah, exactly.
course.
I think, well, yeah, exactly. We're not allowed to mention some of those things, right?
Yeah. Take it to the grave, I guess.
Yeah.
So if you could tell your younger self one thing, what would it be?
I think the main thing for me is it will all be okay. So I remember that getting that A-level result and being absolutely crushed at the time. It was, a lot of my friends had got their results, and there was a group of us that were all planning to go to med school together. So there are a few people who basically got into UCL. I was supposed to go to UCL, and it was really difficult, really, really difficult. And then my place at Warwick was actually through clearing. So that's how I got that place. It wasn't even my backup. My backup was something else, and I decided I didn't want to go there. So it was all kind of a bit fraught and a bit scary, and I didn't know whether I'd actually end up doing medicine in the end. And I think a lot of what Luke said is very true. So the grounding that the school gives you really sets you up. So a lot of those skills, the academic skills, the resilience, also the kind of general people skills that you develop at school really set you up. So actually, even though I had that bump on the road, by the time it came to reapplying for medicine when I was a little bit older, I still had all those qualities and skills, which meant that I was ready and okay to get into medicine. So the main thing is it will all be okay. That's the main takeaway point.
That's really encouraging. And Luke, what advice would you give your younger self?
I really like that. And for me, I think seize the opportunities. A lot of opportunities will come your way. And it's easy to say, no, I don't need to do this. It's not mandatory. And so I'm going to let it go. But you will become a better person if you use the opportunities around you. It will develop you. It will help you in medicine. And those opportunities could be anything. They could be a leadership role within the rowing club you're involved in. They could be getting involved with the First Aid Society. They could be, the opportunity to go on a trip or to go and meet other students. And actually networking, meeting other people is both fun and valuable in your future. Lots of opportunities will come your way throughout medical school, but also through your time at Challenger's. And getting a rounded background, you never know what challenges are going to be faced within that role until you've done it. But once you've overcome that challenge, you know how you did that. And then you can apply that to other things that are going to come your way throughout your medical career. Yeah. Use those opportunities.
That's amazing. Well, thank you very much, guys. It's great to hear from two people who are so passionate about their careers and seem to be enjoying themselves so much. It's really encouraging for me, at least, because I'm applying to medicine. So it's great to hear from you guys. It's been wonderful speaking to you guys this morning. So thank you very much for popping on.